morning, I'm Samantha Myers. Thanks for joining us for this special report. Governor Holcomb is about to hold a news conference about Indiana's primary election. Let's listen in now.
A right to elect our leaders in a free and open and, of course, a safe environment. It's one of the cornerstones, you might say, of this great nation. So it stands to reason that rescheduling such an election should only be done in a time of emergency. And by definition, we find ourselves in that situation. Over the last couple of days, weeks by now, I've received a lot of concern and input and have met with the Secretary of State on occasion about just the potential of postponing or rescheduling our primary election, but the feasibility of being able to properly conduct our May primary on May 5th in a manner that complies with both the charge of social distancing and being able to responsibly conduct this election. And while May 5th is about 7 weeks away, the work that is needed to properly conduct this election and complete it, whether it be programming the machines themselves or sending out ballots, we've got military personnel all over the world, that is all currently underway. And just as I said from this exact position yesterday, my view on that fast approaching primary election is it needed to be pushed back in order to, again, ensure the safety of our county employees, our poll workers, and the voters themselves. But given the uniqueness of an election, I wanted to give the Secretary of State, Connie Lawson, and Chairman Zodi and Chairman Hupfer an opportunity to work out a thoughtful plan for rescheduling this election that would garner a consensus. And I'm pleased to report that consensus has been achieved. There is alignment with this group. And so today I've taken action to reschedule the election that would have been on May 5th to June 2nd. Now, in addition to moving the election to June 2nd, there's some other rules and regulations that will need to be modified to accommodate this election to further protect the health and the safety and ability for people to vote under those circumstances. The Secretary of State, Connie Lawson, our state's chief election officer, is here today, and she'll be able to provide some more in-depth details and discuss some of those modifications that will have to, of course, go before the Election Commission. Secretary?
Thank you, Governor. Welcome, everyone. Before I begin, I just want to thank our Governor and our Lieutenant Governor Crouch for their decisive leadership during this difficult time. It really does make a difference to have a steady hand on the wheel, and I am grateful for all that you are doing. I would also like to thank our state party chairman, Kyle Hupfer and John Zodi, for their work, and I mean hard work, on this issue. As the governor said, we have moved the date of the 2020 primary election from May 5th to June the 2nd. And while many pieces are still in motion, election season is already upon us. I've been in conversation with a number of county clerks, and if the primary remained on May 5th, there would be an urgency tomorrow to send out all military and overseas ballots. And obviously, the clerks are already in the process of recruiting poll workers. With multiple counties suspending normal business, we want to give clerks and election boards time to adjust. So we're making a number of recommendations to the Indiana Election Commission to ensure that every Hoosier has the ability to vote in the primary. We are asking the Commission to do the following: to suspend absentee by mail rules to allow all Hoosiers the option to vote by mail in the upcoming primary election. It's not a requirement, nor does it change policy for the future. It applies to the June 2nd primary only. To allow county clerks to continually mail ballots from now through 12 days before the June 2nd primary to give Hoosiers additional time. To confirm that ballots with a May 5th, 2020 date are valid. To expand eligibility for travel board members to include medical professionals in order to accommodate voters in nursing homes and hospitals. To allow family members the ability to deliver absentee ballots. Currently, only a member of the voter's household may take possession of a voted ballot. The Election Commission will be working on these things, and they will be meeting on Wednesday, March the 25th at 10 a.m. here in the State House in the South Atrium. All of these steps will be in concert to ensure that our election process will continue and that every eligible voter is given the opportunity to vote in the June 2nd primary. It will be a learning process for all of us, and we'll continue to work together in the days and weeks ahead. I am confident that we will conduct a safe, secure, and fair election. Thank you.
Any questions?
Madam Secretary, one of the things that's popped up has been meeting all the deadlines for the Democrats' state convention. I think, John, that's when you guys also pick your national delegates. Is that June 2nd to June 13th going to be enough time to get everything processed, any challenges, provisional ballots, or you guys be kind of cutting it close?
I think it will be cutting it close. As I said, we're all learning, but the reason the June 2nd date, we all came to agreement on the June 2nd date because we want to give the parties, both parties, a time to work through their state convention and national convention processes.
What does this extra month buy election workers? What does it buy the state of Indiana? What difference does an extra month make?
Well, I can't speculate because I don't know what I don't know right now, but the counties have I have been in conversation with many county clerks. I've been in conversation with the leadership of the Clerks Association of Indiana Counties, and they believe that they can conduct an election on June the 2nd.
Will this need to get pushed back again?
Again, I can't speculate, but we've all agreed, depending on the circumstance, we will continue to work together to make sure we have a primary election, and our goal is constant right now for June the 2nd.
Could you talk about specific steps that you're considering to keep poll workers or any election workers safe when we do have these?
Sure. We are getting guidance on a daily basis from the CDC on the safe handling of ballots and as well as sanitizing voting equipment. And so we will make sure that we are absolutely up to date on their recommendations on June the 2nd.
I just wanted to verify, so we don't have an actual agreement to allow no-fault absentee voting, correct?
We do have an agreement. The Indiana Election Commission will have to confirm that when they meet on Wednesday, March the 25th.
Connie, I know, maybe this may be for Kyle or for John, some of the county sheriff I've been here have been having trouble getting some of their usual volunteers to work the polls because they are sometimes a little bit older, and those folks are sometimes more susceptible to the coronavirus. Has there been any conversation, any discussion about mitigating some of those populations' concerns, maybe getting more younger people that may be less susceptible to work the polls?
Well, first of all, we know that counties are having trouble recruiting poll workers, and it's one of the reasons we're delaying for 4 weeks. And so there isn't the ability for a county to combine precincts, and we've given the clerks already the laws that pertain to that. But I would say there are many displaced service workers and others in the state of Indiana who I hope that we can recruit and pay them to work our elections.
From either Kyle or John, what is the status of the convention? And are you considering having votes done by the Central Committee versus the delegates?
Our state committee has a meeting set for April 1st.
Our state committee has a meeting set for April 1st, and so we have been for at least 2 or 3 weeks considering contingency plans for our convention. Obviously, As Connie said, we're not going to speculate on what the conditions will be as we get to mid-June, but we certainly are planning for alternative methods if they're required.
What kind of alternative methods?
Those are to be determined. We haven't sat down as a committee to start talking about them, but all options would be on the table to figure out how I mean, again, there's only really one central function, which is to allow the delegates to vote. So we would be looking at different ways for them to be able to do that.
Have you heard from candidates worried about moving the primaries, I suppose, the voting?
I have not heard anybody who has been particularly concerned about moving the primary from my end. They've just wanted certainty on if it is moving so that they could make decisions in a proper forum, knowing all the facts on the ground.
Let's see, Brandon's question first, I think, or Abdul. I can't remember who exactly asked what question, but as far as the Democratic Party convention is concerned on June 13th, knowing that the primary would be June 2nd, it does cut it very close. So we knew that going in, and we have been talking about what alternatives there would be. Now, the question, what are those alternatives? I think the first thing we would do is consult state law and see what we're allowed to do. There are things I've talked to the election division about already. A different function that we have at our convention, aside from the Republicans, is that we nominate or we elect our national delegation to the Democratic National Convention. And so I'm in consultation with the DNC, the Democratic National Committee, about what that means. There are certain deadlines that are required by the states to meet in order for the delegations to be in place by the July 13th convention in Milwaukee. So like my counterpart, we are considering all alternatives to the convention, but that's starting with having a convention. We believe it's very important to have the convention, to nominate our candidates, to allow our state delegates to have that voice, and to make sure that we have a national delegation that reflects the state.
John, is your central committee in support of this?
Is my central committee in support of this? We've had a good discussion this week. So I've got members that have concerns, and I have members that are in support. So we have had very robust discussions this week as we were in consultation with the with our Republican counterparts. So we, like I said, we have folks who are concerned and folks who are in support. So.
Question about both of you. Is there any concern that people might not show up to the polls on June 2nd, or maybe might not even send mail ballot?
Well, it's always a concern that a person won't vote. Our job as party chairs is to increase the franchise and make sure people can vote. I think this is a good opportunity to talk about the mail-in voting option. We're talking very much about having, the narrative right now is that people are encouraging others to vote absentee by mail. We're also talking about, and we've spoken this week, this group, about mail-in voting as an election procedure. And so that is something that I think is required to look at for June 2nd as well, in case things aren't better from a public health perspective.
From Secretary Lawson or the governor, how will this impact early voting? And when would that start, or might we not have that as usual?
Early voting, the counties are going to proceed with early voting. And if you back up the date 28 days, and I don't want to give exact dates because the Indiana Election Division hasn't confirmed, but it looks like to me early voting would start around May the 5th. So I'm not going to give you an exact date because the Indiana Election Division, again, they set the calendar, and we need to notify clerks of all of those deadlines. And all of those deadlines I may not have mentioned will be moved back from the primary date.
So like the voter registration deadline?
Voter registration deadline would be moved. The requirement for the mailing of military and overseas ballots would be moved. All of those deadline dates would change with the date of the June 2nd primary.
How will this impact campaign finance?
Campaign finance deadlines would change as well. All of those things are backed up from the date of the primary, so all of that would change. And what we will do is we will get that information as soon as the Indiana Election Commission meets and confirms those dates and changes. We will make sure that those are posted on our website so that you can all have that. And obviously we're going to have to be working closely with the Clerks Association as well, so they will have those and know what they need to do.
I have a question.
Sure.
You obviously have a fairly contentious race at your convention this year for Attorney General. Can you guarantee Republicans right now that that will be a full convention vote for that race?
Brandon, as anybody who's lived the last 5 days, anyone who would stand up here and make any guarantees about anything over the course of the next several months would not be a sane individual. So I'm not going to make any guarantees today.
Governor, and another day, another big increase in confirmed coronavirus cases. Can you speak at all about how quickly we're going to see expanded testing and what the state's doing to make sure hospitals, healthcare facilities don't run out of essential supplies?
I did not pay you to ask that question. Let the record reflect. Yes, we have gone from 56 to 79, and I have asked Dr. Chris Box to provide a update on the facts on the ground as they have changed beyond just the cases, but also some supplies and testing capabilities that are coming online and the effect that that's having on the actions that we're taking and will continue to take.
Is there any chance you'll have a shelter in place in California?
Let me ask Commissioner Box to speak, and then I'll take every question you got.
Thank you, Governor. Good morning, everyone. So, as you know from our report at 10 a.m., we have 23 new cases for a total of 79 cases in the state of Indiana. New counties include Allen, Shelby, Vanderburgh, and Vigo. First time we're seeing some in the southern part of Indiana and the western part of the state. We did send just some trial tests over to Lilly yesterday and had 40 tests run by Lilly. They went extremely well. So we've done that times 5 today. They'll be doing 200 more just to make sure that they're up and running, and they'll continue to ramp that up so that hopefully we'll be doing several hundred by the end of the weekend with them. We're continuing to explore other options for testing in the state. There is one of our larger health institutions that is starting to test. We still have LabCorp that is here. Quest will hopefully get online in the Midwest here soon so that we can get some testing done that way. And then the CDC has released specifically for public health labs another way to test that doesn't use the same reagents, so we're hoping to get that up and running here in the near future. We did also have arrival of part of our state, our national strategic stockpile on Wednesday evening late. Thursday, we had Department of Homeland Security and ISDH along with the National Guard unpacking that because it came from 5 different places, so they were all the gowns and all the masks, and what we did was then break that down into what each county would need and repack that. So today we have INDOT and the Indiana State Police out delivering that. They'll be going to over 200 locations today, and those locations have been identified through EM Resource, those individual hospitals or local health departments that have said that they're in the red or the yellow zone. The rest of the SNS will be kept and delivered as the hospital systems and the local health departments need that. I also want to remind everyone that as we start to test more, we're going to get more positives, right? We expect that, so don't be surprised about that. And I want to say that we are continuing to see a lot of Hoosier hospitality around the state. We have appreciated the Guards' help so very much in that they have been here and helping us with planning. They have been helping with logistics. They are helping us make plans so that we could use medics from their department if we needed them. They have the ability to transport patients if we needed that. So all of that planning has been essential on the ground work that we have been doing with them, and we've appreciated their location here with us centrally and their help on that. As we look at Hoosier hospitality, I've had physicians and healthcare workers from all over the state that are now somewhat idle because they're anesthesiologists, they're not doing elective procedures, or they work in some other, maybe a plastic surgeon's office, and they're all offering help, which has been incredible. We have had anesthesia people say, we can run vents for you, we can give you our vents, we can donate it. So we are going to take them up on all of that if we need that here in the state. I would ask you to continue to be good Hoosiers and check in on your neighbors, make sure that they've got what they need, continue to protect our elderly individuals.